An upcoming public hearing will ask Dane County residents for input on how the county should use federal funds that are set aside to help with the opioid crisis. But it's not the first time Dane County has received money to do just that. Our Maddie Heimch has the details on the effectiveness of efforts thus far.
The blue line of this graph represents opioid deaths across Wisconsin, starting to steadily decrease at the end of 2023. And this represents the opioid settlement funding set to come to Wisconsin through 2038 in hopes of keeping that downward trend.
The numbers are going down. So that's good. Something is working.
Rick Rose is the chair of the Opioid Settlement Subcommittee, the sector of Dane County's Health and Human Needs Committee that determines where to spend the funding from the government.
Stating why fentanyl is dangerous through like a bus billboard campaign. As a county representative, I didn't feel that's where the dollar should go.
Rose says instead of public service announcements and messaging, the most effective use of the funds would be tangible services.
We know the crisis. Let's keep it real on what's really happening on the streets now.
He says while deaths are decreasing, older Black men and members of the queer community are still disproportionately affected by opioids in Dane County, and at a higher propensity than most of the country.
These are dollars that are set aside to help these people, and I think that's been lost over the last couple of years.
That's why the subcommittee is holding an input meeting where community members can voice their priorities, whether that be treatment programs, drug checking services, or sober living initiatives.
It's most effective to start where the people are, right? Meet people where they're at.
That public input meeting will take place on April 28th at 5 p.m. in the City County building.